I think one of the biggest compliments a nurse can give you is if they ask you about your orders. And a lot of docs can get bent out of shape about this, like, I'm doctor person, you're a nurse person, do what I say, whatever. Even if there's no overt paternalism, I think it's still ingrained in our training. But most of the time when I've gotten questions about orders or medications or why that fluid and not that fluid, it's either a nurse who is sincerely trying to learn or they're trying to protect their patient. If it is July and you are a nurse and you receive an order that makes no sense to you, it's probably good for you, your liability, the doctor's liability, and the patient if you ask clarifying questions. Because as an attending, it can be difficult, especially if you're a new attending. You're trying to get your own bearings. It's impossible to be omnipresent in a clinical scenario. You can't comb over every single order. It's not practical. But they're often good and thought-provoking questions like, oh, what's glucagon for this globus sensation patient? Why do we use metoclopramide? I thought Reglan was a nausea medication. Why is it part of a migraine cocktail? Those systems are connected. What's capsaicin cream for this person with cyclic vomiting? Why does this patient need blood cultures and a lactate? Or why does this patient need all of these hematology labs? What's a haptoglobin? Why do I care about an LDH? Because especially with blood work, if you are going to add the amount of clinical burden unnecessarily on a colleague, that has real ramifications. There's a cost. There is a logistic challenge. Can it alter your disposition for other patients? Does it make a tough assignment more difficult unnecessarily? It's usually a compliment if they feel comfortable enough to ask you, hey, what are we doing here?